If you know this before stepping into a hospital, it can save both your life and your dignity. Imagine this. It's the middle of the night. There is chaos in the house. Someone close to you suddenly falls ill. An ambulance is called. You reach the hospital. Bright lights in the emergency ward, the sound of machines, nurses rushing around, and the serious expression on the doctor's face. At such a moment, the mind stops working. You think of only one thing. Somehow, the life must be saved. But at that very moment, if someone asks you to sign some papers before starting treatment, or suddenly places a bill of lakhs in front of you, are you able to ask questions? Most people cannot. And this is where a silence begins that later turns into regret. That is why knowing a patient's rights and responsibilities before treatment begins is just as important as choosing the right doctor. Let us tell you, healthcare services are not a favor. They are a basic right of every citizen. Hospitals and doctors are responsible for providing the best possible treatment to patients, but in this entire process, patients and their families are not mute spectators. If you do not know your rights, you may unknowingly become part of wrong decisions. And if you do not understand your responsibilities, even the right treatment can go in the wrong direction. The very first right the moment you are admitted to a hospital is the right to complete information about the cost of treatment. Many people assume that asking questions at that time would be wrong, that saving a life is more important right now. This thinking may feel emotionally right, but practically it can be dangerous. You have every right to know what treatment will be done, what tests will be conducted, how much each procedure will cost, and what the estimated total bill will be. No hospital can say, "We'll tell you later." Providing cost information before starting treatment is your right, so that you can be financially prepared and do not face sudden shocks. Along with this, the patient has the right to know who is treating them. Knowing the doctor's name, their role, and the identity of the medical staff is your right. Treatment is not a mysterious process where the patient is kept in the dark. If a doctor comes, examines the patient, or takes an important decision, you have the full right to know who they are and what their responsibility is. This builds trust and removes confusion. Privacy in a hospital is not just a facility, but a right. When you are consulting a doctor, undergoing treatment, or having any tests done, your personal information and bodily dignity must be respected. Your illness, your reports, your conversations, all of these must remain confidential. Without your consent, no one can share your medical information with a third party. This is not just a moral responsibility, but a legal right of the patient. Along with this, safety is equally important. It is the hospital's responsibility to ensure that treatment is provided in a safe environment. Preventing harm caused by wrong medication, incorrect dosage, or negligence is the hospital's duty. A patient must have the confidence that the place where they are receiving treatment prioritizes their physical safety above all else. One very important right is the right to receive treatment without any discrimination. A patient's religion, caste, age, gender, financial status, or physical and mental ability cannot be grounds for discrimination in treatment. The hospital's job is to treat, not to judge. Whether the patient is rich or poor, a VIP or a common citizen, everyone must receive equal respect and care. Understanding and knowing complete information related to treatment is also the patient's right. You must be informed why a particular treatment is being done, what its benefits are, what the risks are, and what alternatives may be available. This information should be given in a language you can understand. If medical terms are unclear, asking questions is your right. Responsibility cannot be avoided later by saying, "The doctor had explained it." Until the patient or their family is properly informed, the decision remains incomplete. In the SAM context, the patient also has the right to accept or refuse treatment. If the risks related to a procedure, surgery, or treatment have been explained to you, you may choose to accept or decline it according to your will. This decision should not be made under fear or pressure. Performing major treatment without the patient's consent is wrong, except in situations where the patient's life is in immediate danger and a decision is unavoidable. Informed consent is one of the most important responsibilities of a hospital. Before any major test, surgery, anesthesia, or blood transfusion, it is essential to take the patient's informed consent. This does not mean merely getting a signature on paper. It means that the entire procedure is explained to the patient, their questions are answered, and only then their consent is taken. A patient also has the right to see and obtain their medical reports and files. Test reports, discharge summaries, lists of medicines, these are all part of the patient's information. According to hospital policy, these documents should be made available to the patient. This is important so that during future treatment, another doctor can be given accurate information. In addition, the patient has the right to receive information related to pain and discomfort management. Suffering pain should not be considered a part of treatment. If there is pain, the patient has the right to know what options are available to manage it. The patient also has the right to be referred to another hospital if needed. If a facility is not available at a particular hospital, the patient should be referred to the appropriate place. If a patient has any complaint related to the quality of service, they also have the right to register a complaint and receive a response. Making a complaint does not mean going against treatment. It is a way to improve the system. Along with this, the patient also has the right to choose food according to medical advice and to follow their religion. Now let us talk about the patient's responsibilities, because rights are strong only when responsibilities are fulfilled. The first responsibility is to provide complete and accurate information related to one's health. The patient must honestly inform the doctor about past illnesses, ongoing medications, allergies, and medical history. Hiding any information can put the treatment at risk. The patient should provide correct identification and contact details. Wrong address or incorrect information can create problems in treatment and follow-up. In addition, following the doctor's advice is also the patient's responsibility. Taking medicines on time, getting tests done, and following dietary instructions are important parts of treatment. It is also necessary to behave with respect and cooperation toward doctors and hospital staff. They are there to help you. Anger, misbehavior, or violence cannot be justified under any circumstances. Following hospital rules is also the responsibility of patients and their families, such as visiting hours, no smoking rules, and guidelines related to mobile phone usage. Fulfilling financial obligations related to treatment on time is also important. If there is any difficulty in payment for any reason, it should be clearly communicated to the hospital. Hiding or delaying it only increases the problem. If any problem arises during treatment or the patient's condition worsens, it is the responsibility of the patient and their family to inform the hospital immediately. Attending follow-up visits on time and informing in advance if an appointment cannot be kept are also important to ensure continuity of treatment. A hospital is a shared space. Maintaining a safe and calm environment for other patients and staff through one's behavior is also the responsibility of every patient. Giving your medicines to someone else or taking someone else's medicines yourself can be dangerous and should be avoided. Treatment in a hospital is not just the doctor's responsibility. It is a partnership. When a patient knows their rights and fulfills their responsibilities, treatment becomes better, safer, and more dignified. The most important thing is that decisions taken in fear or ignorance are often wrong. Knowledge is the strength that keeps you empowered even in the most difficult hospital situations. So the next time you or someone close to you goes to a hospital, do not rely only on prayers. Know your rights, ask questions, and fulfill your responsibilities. Because the right treatment does not come only from medicines, but also from understanding.
If our video has taught you something new, do not forget to like and share this video so that this information can reach others as well. Your likes and shares are a source of inspiration for us. If you have any questions or suggestions, please let us know in the comments. It will be our honor to answer your questions and listen to suggestion. And yes, if you like our content, subscribe to the channel and press the bell icon so that you stay connected with every new story. Thank you. GRT Business YouTube channel sources: news from various news agencies, opinion polls and other public sources. We try to ensure that every report and summary is accurate and verified, but we are not responsible for any dispute or error. Our aim is only to provide you with accurate information.